7 early signs of pancreatic cancer. In this video, I'll focus on insulinoma. It has unique features I'll explain here. Pay attention to these signs and symptoms. If caught early, insulinoma is curable in 90 to 95% of cases. For every 20 people with this cancer, 19 can be cured if they seek help early. So first, what is insulinoma? Insulinoma is a neuroendocrine tumor. It's a tumor that can produce hormones. In this case, it overproduces insulin. You might wonder, how's it different from other types? Like adenocarcinoma, the most common type. It's aggressive with a lower cure rate than insulinoma. Adenocarcinoma doesn't produce hormones. So that's why insulinoma gives specific signs and symptoms. The specialist who treats neuroendocrine hormone-producing tumors is the endocrinologist. They also handle endocrine glands like thyroid cancer and adrenal cancer. Surprised to see an endocrinologist talking about cancer in this video? That's why we work jointly with other specialties. By the way, comment which city you're watching this video from. Let's understand normal function versus insulinoma to make sense of this video. With low glucose levels, insulin production naturally decreases. Why? The body doesn't want blood sugar to keep dropping. In insulinoma, it's different. Even with low blood sugar, the tumor keeps producing insulin. This can lead to severe hypoglycemia. Your blood sugar drops dangerously low, even risking your life. So what are the 7 signs and symptoms? The first sign in people with this insulin-producing tumor is increased hunger. You experience a change in your eating habits. But wait, I thought cancer decreased appetite? This is where we see a key difference. With insulinoma, this neuroendocrine tumor, you get hungrier. Why? As blood sugar drops, it produces more insulin, unlike normal. To cope, what does your body think? Oh no, I need to eat. Because eating raises your blood sugar levels. So extreme hunger. Be careful, folks. Why? Changes in appetite can be caused by various factors. In this case, there's no apparent cause. For instance, you haven't started new meds, increased exercise, or face stress like an exam. In those cases, hunger would increase. So, we're talking about unexplained increased hunger. The second sign to watch for is palpitations. It feels like your heart's in your throat. Many people describe feeling their heartbeat. This symptom often occurs in episodes. What does that mean? It happens in bursts. Unlike hyperthyroidism, it's not constant. Palpitations occur when blood sugar levels drop. After eating, your blood sugar is normal. Insulinoma palpitations happen during low blood sugar, not after meals. So what exactly is hypoglycemia? It's blood sugar levels below 70 milligrams per deciliter. In countries using millimoles per liter, levels under 3.9 would indicate hypoglycemia. I'll explain later which hypoglycemia cases to consider and in what circumstances. After discussing signs and symptoms, I'll also cover the diagnosis. The third sign is tremors. Why do tremors occur? When blood sugar drops, the body compensates by increasing adrenaline and cortisol. If sugar levels get too low, tremors can be one of the signs. Note that hypoglycemia should be considered even without an obvious cause. For instance, type 1 diabetics must use insulin. That's a different scenario. This applies to those not on diabetes meds, which can lower blood sugar too much. We need to investigate why this is happening and mark it with an asterisk. Insulinoma is rarely diagnosed as it's an uncommon tumor, often missed due to unfamiliarity with symptoms. The fourth sign is cold sweats. Unlike sweat from exercise, cold sweats come with chills and mental confusion. As the tumor produces insulin uncontrollably, these signs I mentioned, numbers 2, 3, and 4, tend to progressively worsen over days and months as the tumor typically increases its production over time. That's why it's crucial to notice these signs as soon as they appear. I want to emphasize that these signs of hypoglycemia, low blood sugar levels, are never normal. Our body has mechanisms to prevent your blood sugar from dropping to 40 or 35, for example. We can raise blood sugar levels even during fasting periods, okay? So, hypoglycemia is never normal and always needs to be investigated. If you take away this message, I'll be satisfied. As I mentioned, 90 to 95% of insulinomas can be cured, but it's crucial to catch it early to avoid complications from very low blood sugar. When adrenaline rises, your heart is under more stress. For those at risk of heart attacks, this is an added risk factor. We aim to avoid hypoglycemia in cardiac patients as it can increase heart attack risk. And sign number 5 is weight gain. Why? Insulin is the most anabolic hormone. Along with increased hunger, you'll gain weight. This contrasts greatly with other tumor types, for instance, where people lose weight. It's a well-known cancer sign, unexplained weight loss. Here it's different. It's weight gain. You might be wondering, why does this happen? Why does this tumor cause this? Insulin's job is to move blood sugar into cells and muscles. Increased insulin production can lead to weight gain. This is one of the signs. Sign number 6 is weakness and low energy. This is a non-specific sign present in various conditions. However, since it's also present in insulinoma, I should mention fatigue, trouble waking up, weakness, and difficulty with physical activities, okay? I won't focus on this as it's very non-specific. Sign 7 needs special attention, seizures. If someone with no seizure history sees a neurologist and finds no cause, it could be due to low blood sugar. If someone has an insulin-producing tumor, they're experiencing hypoglycemia and seizures, putting them at high risk. So we need to be vigilant. For seizures, check blood sugar levels as hypoglycemia can cause them. How is the diagnosis made? How do we suspect it might be an insulinoma, an insulin-producing tumor? What are its characteristics? You've seen the symptoms. A key clue in tests is lab-confirmed hypoglycemia with insulin levels. Blood glucose may be low while insulin is high. Why did I say may be low? Because this test can be misleading, as I mentioned. Many have hypoglycemic episodes, but if tested when levels are normal, it can be confusing. It's crucial that when these signs and symptoms appear, the doctor may order a fasting test, monitored by a medical team. During fasting, our insulin production often decreases, as I mentioned earlier. However, this won't occur with melanoma. It's a way to document this along with other specific tests, like C-peptide. This can also be elevated as it's produced alongside insulin. If suspected, we'll do imaging tests like CT, MRI, or sometimes ultrasound. In most cases, this tumor is located in the pancreas. We try to find any tumors there, as the definitive treatment is usually surgical. The tumor is removed and analyzed to confirm if it's truly an insulinoma. The most common type of neuroendocrine tumor is insulinoma. Do you know anyone who's had pancreatic cancer? And this specific type, insulinoma, do you know anyone with these symptoms? On a scale of 0 to 10, how would you rate this video? If it's a 10, I'll make more videos like this. Now, I'll suggest another video for you to watch. It's about a topic I discussed, vitamin D. Vitamin D has risks and benefits often discussed in relation to cancer. Does vitamin D lower or raise cancer risk? In that video, I cover all about vitamin D, including the levels you often ask about. Take care. See you next time.